enjoy it. That's what counts. Good morning, everyone, and welcome to the presentation. We're going to give everybody a few more minutes to get here, and then we'll get started. Thank you. Good morning, everyone. We're just going to give everybody another minute or two to join, and we'll get started in just a couple of minutes. Thank you. All right, good morning, everybody. My name is John Ellis. I'm going to be your principal voice from the computer today. As we go through our agenda, as you know, we're talking about coronavirus today. I'm going to be joined by my colleague, Mary Dempsey. We're both working remotely, so we're getting through this presentation, the technical issues as best we can. Mary, are you there? Okay. We'll work on connecting Mary to the presentation. I'll tell everybody in terms of potential technical difficulties we may have, if you run into any issue where at some point you start to lose connectivity to the presentation, if you log out and then just reload the presentation, that should fix the problem. Couple of other technical questions. We're going to ask if anyone has any questions that you hold your questions to the end, and then we'll take questions and answer them as best we can. So the agenda for today, our presentation is divided into 4 principal segments. We have pay and benefits issues, which we'll deal with first, ADA and OSHA concerns, FMLA and leaves of absence, and unemployment and workers' compensation. Throughout the presentation, where appropriate, we're also going to address provisions of the recent Families First Coronavirus Response Act, which we're going to call the Coronavirus Act or the Response Act throughout the presentation. And we'll talk about its key provisions, where they fit into our various topics. Really, the 4 principal provisions here for employers, 4 hottest provisions, if you will, are the emergency paid sick leave, the emergency FMLA expansion, there's a payroll tax credit, and emergency unemployment compensation benefits. So we're going to start with pay and benefits issues. You know, we've tried to organize this by looking at questions that we've been receiving from firm clients and kind of hitting all of those hot topics that we've been getting a lot of questions about. And one of the hottest topics that we've seen is really reduced work schedules and how do we pay people on a reduced work schedule. There are 2 classifications of employees we're going to worry about. Non-exempt or hourly employees who are paid overtime, and employees who are exempt from the overtime requirements of the Fair Labor Standards Act and the PA Minimum Wage Act, who are, generally speaking, salaried employees. Hourly employees, this is pretty simple. I mean, hourly employees are generally paid only for their hours worked, unless they're going to use earned, accrued, vacation, sick, personal time. Some companies use a single designation of PTO to make up that difference in pay. Now, the exempt salaried employees, it gets a little bit more difficult. because by law, a salaried employee has to be paid the same amount each week, and this is an exact quote from the law, regardless of the quality or quantity of work. So what that means is that you can't fluctuate the pay of an hourly employee with the amount of work they perform. Really, their salary has to remain fixed and constant each week. Now, there are some strategies that you can use for an exempt employee. The law does make clear an employee does not have to be paid, an exempt employee does not have to be paid in a week in which the employee performs, quote, no work at all. Work obviously includes remote work. So what that means is if you have a reduction in work that is so significant that you have an exempt employee who's going to be performing no work at all, including nothing remotely, not checking emails, not covering calls, you do not owe the employee pay for that week. But you need to make very sure that the employee isn't performing any work that week. And I would advise you, just as a good practice, as a best practice, it would be best to make that instruction, put that instruction in writing. Now, one other thing you can do is a pay cut. And to give you an example of this, during the Great Recession, our office had a number of clients who instituted a pay reduction measure for salaried exempt employees during that crisis. And what that looked like, the employer would give management, either all managerial employees, all salaried employees, or simply certain classes like executive management, an across the board pay reduction of 10%, 20%, 25%, that they would leave in place for a certain fixed period of time. So, hypothetically, in the current situation, if you wanted to implement something like this, you would be able to say, and you'd want to do this in writing, give the employees a communication that would say something along the lines of, look, because of the crisis with coronavirus and our reduction in business, we are going to institute an across the board 25% salary cut for all managerial employees. This cut will remain in place through April 30th, May 30th. You need to pick some reasonably significant calendar date so it's clear that your reduced salary figure is not fluctuating with quality or quantity of work. But once you pick that date and establish that percentile reduction, you should be able to leave it in place. And look, if worse comes to worse, if you reassess, if you reach that date, if you reach April 30th, if you reach May 30th, and situations still do not allow you to restore employees to their regular fixed salary, you can certainly put into effect an additional period of time. You can extend that measure if you need to. But it's a good idea to really establish an initial fixed date, even if not a fixed date, but an initial date, even if it's a date that you have to come back to and reassess later. One of the other questions that we get a lot of, one of the other issues that we've seen a lot of questions on is health insurance for reduced schedules. So you always check plan documents and follow their requirements. You never want to put yourself in a position where your carrier can deny coverage or employee claims due to an error that you made. That can cause additional complications. Now, in terms of how you're handling premiums, you can really, for a reduced schedule, you can either waive the employee premium, or you can pay the employee premium contributions and hold them in abeyance, recover them when the employee returns to their regular work schedule. One thing you're generally not going to be able to do during insurance for reduced hours is to reduce employees' pay, to increase the amount of the premium that an employee pays. Now, during furloughs or layoffs, the answer changes a bit. Depending on your plan documents, the employee normally would be sent a letter separate from the layoff letter that would give them Cobra rights and give them an enrollment form and advise them of their rights. Now, typically, when an employee is when an employee is laid off or furloughed, your plan document will establish when their coverage will stop. In some plans, it will stop immediately. On some plan, it will stop in the 15th of the month in which the layoff takes place, or it may stop on the last day of the month in which the layoff takes place. And there are some plans that give the employer flexibility to choose a different later date. Now, the reason that we say always look at your plan documents, we had a situation a few years ago where we had clients who would typically, when someone was laid off, would simply to continue to cover the client under their employer plan for some length of time after the employee left. Like hypothetically, if an employee was let go today, the employer would cover them under their existing plan through April 30 or May 30, and then they would give them Cobra rights at that time. And some health insurance providers started to crack down on that and require that an employee be Cobra'd as soon as their health insurance coverage through the plan would naturally expire. So we always tell employers that they want to check with their provider and check with their plan provider before taking an action or before informing employees what happens with their Cobra. Because the last thing you want to do is get tripped up by your plan provider if your plan provider won't let you carry out the structure that you want. So switching gears and talking about Cobra, we're just going to go through this pretty briefly, but I want you to be aware of it. Cobra, federal Cobra, applies to employers with 20 or more employees. An employee has 60 days after the qualifying date, after they lose coverage due to a termination, to elect coverage, and that coverage runs up to 18 months. There may also be special circumstances that would allow for additional Cobra time beyond 18 months. And Cobra may not apply if the company goes out of business. For instance, if an organization stops sponsoring any plan at all, generally speaking, it does not have to grant employees Cobra rights if it has no plan whatsoever for anyone at the company. I would suggest if you're looking at that scenario, you'd be well advised to consult with counsel to make sure that you're not violating any provisions of Cobra. Pennsylvania also has a mini Cobra law. This was passed during the Great Recession. It applies to employers with 2 to 19 employees. And while employees also have 60 days to elect coverage under PA Mini Cobra, that coverage is only up to 9 months. If you're looking for Mini Cobra paperwork or enrollment forms to give to your employees, you can find those forms online from the PA Insurance Department. If you Google PA Mini Cobra, those forms should come right up at the top of your search page. So at this point, we're going to switch gears briefly and start talking about ADA concerns that have been implicated by coronavirus. We're going to focus again, rather than an introductory primer on the ADA, we're really going to move through almost a question and answer format here and really try and keep this targeted at very practical advice. Now, one note that I would make, because the uniqueness of a pandemic, or because a pandemic is a unique situation, special rules apply. The Equal Employment Opportunity Commission has 2 principal pieces of guidance on this. One on pandemic preparation or preparedness during an influenza pandemic that was issued in 2009, and one more specific piece of guidance that was released just a few weeks ago related to the COVID-19 pandemic. And what that makes clear, because the World Health Organization declared that COVID-19 constituted a pandemic on March 11th, there are some things that employers can do right now related to COVID-19 without violating the ADA that would be ADA violations otherwise. So we're going to try and note these things as we go through the presentation, but I wanted to hit 2 principal points right up front. And that is that the advice that we're talking about only applies to COVID-19 and COVID-19 related symptoms. It would not apply to any other health condition that employees have currently. And even with regard to COVID-19 and COVID-19 related health symptoms, we should keep in mind, which generally speaking are upper respiratory symptoms that would be and share many symptoms with a cold or with influenza. But even with regard to these symptoms, some of this advice will stop applying when the pandemic declaration related to COVID-19 is rescinded. So let's work through some of these questions. And the first one, and probably the biggest one that we've seen, is what can I ask when employees call off sick? Due to this recent EEOC guidance, and because we have a pandemic declaration, you can ask employees who are claiming to be sick if they have certain specific symptoms that are related to COVID-19. And generally speaking, those symptoms, as they've been identified by the EEOC and the PA Department of Health, include fever, chills, cough, shortness of breath, and/or a sore throat. And as you can see, these symptoms, as I said before, they're all symptoms of COVID-19, but they're also symptoms of other issues like a cold or an ADA condition, influenza, something along those lines. So what I would suggest here, you can ask about these symptoms, but keep in mind that just because an employee is showing these symptoms, it does not necessarily mean that they have COVID. They may have something else. And for purposes of ADA compliance, you also have to keep in mind that all information received as a result of these inquiries must be maintained as a confidential medical record. That means it cannot be shared with other employees. And if you have that information in writing, it should generally be maintained in a locked file cabinet in an office that is locked if someone is not in it. And you would want to control access to those files for people who have a real need to know. So the next most popular question is, now that I know I can ask my employees if they're showing COVID symptoms, can I send employees with those symptoms home? And the answer is yes, you can. And again, we need to keep in mind that this is a special rule. We can do this because the World Health Organization has declared that COVID-19 constitutes a pandemic, and the Centers for Disease Control have issued very clear guidance that employees who have symptoms of COVID-19 should leave the workplace. So, in a nutshell, you can ask about symptoms, and you can send employees who are showing symptoms home. As a general rule, the CDC recommends that if an employee is coming in showing signs of COVID, showing a fever, cough, chills, that employee should be instructed to remain home for 24 hours after they become asymptomatic without using cough medicine. So, in other words, whatever they're taking, cough medicine, their Delsum, their Robitussin, whatever they have in their medicine cabinet, they should not be allowed to return to work until they are asymptomatic 24 hours after they stop taking that medication. Can I require a doctor's note before employees return? This one gets a little bit more difficult. The short answer is yes, you can require a doctor's note, but it's going to be very difficult for employees to get that. In many areas of the country and increasingly locally, healthcare professionals are pressed for time. Hospitals are slowly becoming busier, or rapidly in some areas, becoming busier and busier, and are getting overwhelmed with requests for this type of information. So there are really alternatives you may want to consider. Getting the form from a local clinic, an email to certify that someone does not have COVID-19. Something along those lines. It's also worth noting that you can draw a distinction between someone who has symptoms of COVID-19 and someone who has a confirmed result of COVID-19, because we're starting to see questions from employers who have employees who are either under a quarantine order related to COVID or have actually tested positive for having COVID. And I think it's important to look at someone we're sending home for cold, flu symptoms, something along those lines, who we have no reason to believe that they have COVID, they haven't gone for a test. We may want to certainly relax our doctor's notes requirements in those situations. On the other hand, if we're dealing with an employee who has either confirmed close contact, let's say a member of their immediate household family has COVID, or the employee themselves has been diagnosed with COVID, I think those are cases where we would want to stick to this requirement of getting a doctor's note more strictly. So some organizations, some businesses are still in operation. You know, businesses are life supporting as included in the governor's order, and are still ongoing businesses and are still hiring and screening applicants. So, you know, another question here: may I screen job applicants for symptoms of COVID-19? And the answer is, it's the same rule that normally exists under the Americans with Disabilities Act. You can do that, but only after you've made a conditional offer of employment. So in other words, only after you've given the employee an offer that states, we're offering you employment with our organization, contingent upon your passing all pre-employment screening. And if an employer chooses to screen an applicant, you can't pick and choose who to screen. If we're going to screen someone for COVID, we have to do it for all entering employees in that same job or job classification. You can't pick and choose. Some other questions related to applicants. You know, may I delay the start date of an applicant with COVID-19 symptoms? And again, the answer to this is yes. The current guidance is that an individual with COVID-19 or associated symptoms should not be in the workplace. So just as you have the freedom to send an existing employee who has COVID-19 home, you also have the ability to delay the start date of an applicant who has COVID-19 symptoms. Another question, this was also contained in the EEOC's COVID guidance. May I withdraw an offer when I need the applicant to start immediately, but the applicant has COVID-19 or associated symptoms? And again, the answer to this question is yes, but I'd ask everybody to note that we have the word immediately in italics and underlined. This wouldn't apply in a case where you're giving someone an offer letter with the idea that they're going to start in 2 weeks, 3 weeks after they give reasonable notice. This is a case where you're giving an offer letter. Let's say it's a healthcare provider that needs nurses very, very desperately, and is trying to get nurses in and is looking for a start date immediately, like the next day, the day after. If you need an immediate start date like that, and you have another candidate who isn't showing COVID symptoms who would be able to start immediately, you'd be able to withdraw that offer. But generally speaking, this is probably not going to be useful for the vast majority of employers who are making job offers. So we're going to talk a little bit here about OSHA standards, and I'm not going to spend a lot of time on this because for most employers, OSHA requirements for this are relatively simple in the grand scheme of things, at least. Certainly employers like healthcare providers where there's definite direct contact with COVID patients, and even organizations that are open like grocery stores where there's even if you're not directly interacting with COVID patients, for instance, in a grocery store, because it's still open, employees are still directly interacting with members of the public who may be COVID patients or may be showing signs of COVID. And while the standard for a grocery store is certainly not going to be as great as the standard for a healthcare provider, there are increased standards that OSHA recommends for those employers. And you'll see at the bottom of this slide, I've included a link here. OSHA has put out guidance on preparing workplaces for COVID-19. That's a free publication that's available online. And if you're concerned that your organization has employees who are working with the public or who are working in a healthcare setting who may have increased exposure to COVID, you can download that guidance, and that should give you some additional information in terms of how the general duty clause should apply to you. Now, I assume everyone on the call is aware of OSHA's general duty clause, but I'll run through it quickly. OSHA, as we all know, has a lot of very specific standards that apply to particular jobs, particular types of industries, particular types of equipment. The general duty clause is OSHA's catch-all provision, which requires employers to furnish a workplace that is free from recognized hazards that are causing or are likely to cause death or serious physical harm. So how you would apply to that is generally it's a due care standard, for lack of a better way to put it. In some ways, some basic measures that all employers can take to comply with this regarding COVID, they're really pretty simple. Yeah, you send sick employees home, encourage sick employees to stay home. You want to explore remote work arrangements where they're possible. And I can tell you that we have a lot of clients who did not really look at remote work arrangements at all prior to this pandemic, but who are doing it now because they need to ensure continuity of their business. And in many ways, many cases, remote work arrangements are the only way to do that. You want to ensure that you're taking appropriate cleaning measures and make cleaning supplies available to employees. And that essentially means you want to make sure that you're cleaning and wiping down common surfaces with Lysol or with some other cleaner that has antiviral properties. That would include countertops and break rooms, desks, keyboards, phones, doorknobs, or door bars are a big one as well. You can put up signage regarding social distancing, workplace etiquette involving coughing, sneezing, and tissue disposal. There are actually simple posters and very good posters on all of these things that are available from the Centers for Disease Control website. Again, there are also CDC posters on regular hand washing and instructions on that. And you can get these posters and put them up around your workplace just to encourage increased awareness of all of these things. Now, again, there are some employers who may have other requirements. If you're in the higher exposure industry, there may be requirements for some personal protective equipment and things of that nature. For most employers that have who are in a low risk of exposure category, there's not a PPE recommendation. I would say this: we've gotten a number of calls from clients who there seems to be a rumor circulating now that the CDC has recommended that employers make N95 antiviral masks available to their employees. I have not seen any standard on that point. In fact, everything that I have seen indicates that that is required for healthcare, but generally not required for other organizations that don't have direct face-to-face contact with COVID patients. And frankly, if you've watched the news, I'm sure all of us have seen Governor Cuomo in his 11 o'clock news conference talking about shortages of N95 masks for healthcare providers. So if you're approached by employees, if you're not in the healthcare industry and you're approached by employees who say that there's a standard that's applicable to them where you're required to provide N95 masks, I'm not aware of any such standard, and I do not believe that any such standard exists. The one point that I would make is that isn't to say that you should ignore the employee's response. As a practical matter, what we're seeing and what we're advising clients, when you have employees who are approaching you with concerns about coming to work, the best thing you can do is sit down and say, look, we're at work because we're classified as a life-sustaining industry under Governor Wolf's orders. People are depending on us to stay in business. And then you want to emphasize what you're doing. I say, look, we're sending sick employees home. We're asking employees about their symptoms, and if they have COVID, we're telling them to go home. We've increased our cleaning measures. We have cleaning supplies available to you if you want them. We're instructing everybody with regard to social distancing and coughing and sneezing etiquette. And you want to go through all these things and remind people what they're doing and tell them, look, we're keeping very close attention on this. We're doing our best to make sure that COVID is not coming into our workplace. We're monitoring the CDC guidance on this. And you want to try to reassure employees, because as a practical matter, if your employees, what we're seeing is if your employees trust that you're monitoring this and that you're acting responsibly, thus far, those employers have been able to avoid most problems with regard to general fear in the workplace, and that fear leading to increased absenteeism. Employers who are taking a harder line, where employees don't necessarily have that same level of trust, are seeing bigger problems. So to a certain extent, at this point, I think a lot of these difficulties are really psychological. and recognizing that your employees are afraid and recognizing that they need some reassurance from you. If you can do that, if you can deal with the problem in that way, it's going to deter a lot of issues that you may run into moving forward. At least that is our hope. So on that note, we're going to change gears again and move on to the FMLA and leaves of absence portion of the presentation. And it's in this portion of the presentation that we're going to talk certainly about the current FMLA statute, and then we're going to get into two measures that were in the Coronavirus Relief Act, the Emergency Family and Medical Leave Expansion Act and the Emergency Paid Sick Leave Act. And then finally, we're going to talk about discretionary leave or other forms of leave that may be available under your workplace policies. So, current FMLA. The FMLA, the existing provisions of FMLA prior to the Coronavirus Act, apply to employers with 50 or more employees within a 75-mile radius. Now, I would note here that I don't want to get too bogged down in the FMLA definitions, but note that the 50 or more employees, the FMLA measures employees. It's not full-time employees or full-time equivalents. It's the number of names on payroll for 20 or more weeks within the last 52 weeks. So you want to be looking at names on payroll without really regard to whether they're full or part-time. Now, from an employee's viewpoint, to be eligible for current FMLA leave, as we're calling it, an employee must have worked for the employer for at least 1 year. Now, that does not have to be, that portion of the statute does not have to be continuous employment. For instance, if an employee is seasonal and worked for you, let's say 8 months in 2018, 8 months in 2019, and is back and working towards that 8-month figure in 2020, that employee has been employed for 1 year in total over that 3-year period and would meet that prong. Now, in addition to having worked for you for at least 1 year, the employee also has to have worked at least 1,250 hours in the immediately preceding 12-month period. And if an employee does not hit each of those requirements, they would not be eligible for the current FMLA. Now, we have all of the reasons for FMLA leave set forth here, and a lot of them are not immediately relevant to coronavirus. So I'm going to jump down to the second and third bullets on the page. That is to care for an immediate family member, spouse, child, or parent with a serious health condition, or if the employee needs leave due to their own serious health condition. Now, in terms of the definition of serious health condition, I'm going to go into this because this is going to be, understanding this definition is going to be very important for purposes of understanding how this act applies to coronavirus. A serious health condition is an illness, injury, or impairment that results in an overnight stay in a hospital or continuing treatment by a healthcare provider. And if you look down at the second bullet, this is how most employees fall into the FMLA statute. It's treatment by a healthcare provider on at least one occasion that results in a continuing course of treatment. And a continuing course of treatment can be prescription medication. So this is where we are, and this is where we're principally seeing someone fall under the FMLA and the coronavirus issues. Certainly, and I think pretty obviously, if you have an employee who's diagnosed with coronavirus and is hospitalized, certainly that employee is going to fall under the FMLA statute. But where we're seeing this apply more immediately in terms, or at least right now, with most employers is, really employees who are immunocompromised, employees who for whatever reason have a medical condition, which could be leukemia, MS, someone who's currently undergoing cancer treatment, or has recently ended cancer treatment, someone who has a condition, a serious health condition that has left their immune system vulnerable to viral infection, and who is recommended by their physician not to come into work. Almost all of those conditions, really all of those conditions that I outlined, would all fit a requirement of treatment by a healthcare provider on at least one occasion that results in a continuing course of treatment. And they may meet other definitions of the statute as well. So if you're covered by the FMLA and you have an employee who's coming into you and is saying, look, I have a condition where my doctor has recommended that I stay home because I can't, it's inadvisable for me to be in a position where I'm exposed to members of the public or where I'm circulating with members of the public right now, that employee will likely have an eligibility for FMLA. Now, I'll note this, if you can make remote work available for that person and they can perform their job remotely, then they don't need FMLA leave because they're going to continue remote work. But if you're dealing with someone in a position for whom remote work is not available, FMLA is going to be an answer there for those health conditions. Now we're going to change gears and talk about the Coronavirus Act FMLA. This is markedly different from the regular FMLA leave in terms of eligibility. It applies to any employer with less than 500 employees and any employee who has been employed by the employer for at least 30 calendar days is eligible. So this is a completely different eligibility provision than what we had under the prior FMLA statute. I'll note that there is a provision in this statute that would give a carve out of this new FMLA leave for an employer with fewer than 50 people for whom granting the leave would endanger the business as an ongoing concern. We're still waiting for clarification from the Department of Labor on that point. I did see that the Department of Labor issued some guidance this morning that may have some additional information in it. But if that's the case, we will look that up and get a client alert out on it. Now, the Coronavirus Act FMLA leave benefit is only for one reason. It's a 12-week leave benefit to care for an employee's children or child or children because a school or child care closure related to coronavirus or because the regular child care provider is unavailable due to coronavirus. This works from the same 12-week leave benefit as the rest of the FMLA statute. The first 10 days of the FMLA leave are unpaid, although an employee may qualify to use the emergency paid sick leave benefit during those 10 days, which we'll talk about in a minute. But under the FMLA statute itself, the first 10 days are unpaid. The subsequent 10 weeks, assuming that they're needed, the employee has to be paid 2/3 of the employee's regular rate for the number of hours the employee would be regularly scheduled to work. Now, that benefit is capped at $200 per day and an aggregate of $10,000 over that 10-week period. So let me try to summarize this because I know this gets a little. My head was spinning when I first read the statute, and I'm sure other people's were as well. It's a 12-week leave benefit, the first 10 days of which are unpaid unless some other form of paid leave is available that the employee can use. After those 10 days of unpaid leave, it converts to a paid leave at 2/3 of the employee's regular rate, up to a cap of $200 per day and an aggregate of $10,000. Now, moving on to the next paid leave provision in the statute, the Coronavirus Paid Sick Leave Act. This applies to private employers with fewer than 500 employees and public employers with at least one or more employees. The leave benefit under this act, what is it? A full-time employee gets 80 hours of leave. And I should say we have 80 hours here, but it's really whatever the employee's full-time schedule is. If your full-time schedule is 35 hours, then a full-time employee would get 35 hours of leave each week to a total of 70. Part-time would get the average number of hours worked over a 2-week leave period. Now, this is where the Emergency Paid Sick Leave Act starts to get very complicated. There are 6 reasons that an employee can take paid sick leave, emergency paid sick leave under the Act. The first 3 reasons are compensated at a different level than the last 3 reasons, which is why we have this broken up the way we have. So the first 3 reasons that an employee can take this leave. The employee is subject to a government quarantine or isolation order due to COVID, The employee is ordered to self-quarantine by a healthcare provider due to COVID. The employee is experiencing symptoms of COVID-19 and is seeking a medical diagnosis. These three types of leave are paid at the employee's regular rate, not to exceed $511 per day or $5,110 in the aggregate over that 2-week period. Now, where we've gotten most questions from clients on this, and there's a great deal of uncertainty floating around this particular point. Two versions of this act, of the Family's First Coronavirus Relief Act, were passed by the House of Representatives. The first version, which was passed Friday of the week before last, included a provision in it where this emergency paid sick leave would also be payable if an employer closes due to coronavirus. That version of the bill was passed on Friday. There were technical corrections that were made over the weekend, and a corrected version of the bill was passed on Monday. It is that corrected version of this bill that became law, and the corrected version of this bill did not include that provision about an employer closure resulting in payment. Now, we have gotten some client questions as to whether the current shutdown that we're under from the governor would qualify as a quarantine or isolation order. And in the absence of specific guidance from the Department of Labor on this point, I think the answer to that question is no. And the reason I'm saying that are that the terms quarantine and isolation are both defined terms under the Pennsylvania Public Health Law that relate to specifically keeping individuals isolated when they have a COVID diagnosis or are showing symptoms of COVID. So I don't believe that the general shutdown that we have from the governor is going to trigger that provision. I think you're going to be looking for something more, specifically a quarantine or isolation order from a public health authority or a self-quarantine order from a healthcare provider. Hopefully I didn't lose anybody there. Now, the last three reasons for FMLA. The first of these reasons, the employee is caring for someone who's been subject to a quarantine, isolation, or self-quarantine order. So in other words, this section of the statute would apply if the employee themselves is not quarantined, but they're caring for someone who is. The employee is caring for his or her child due to a COVID-19 related closure of the child's school or child care facility, or because their regular child care provider is unavailable. If this sounds a lot like what we just went over for the Coronavirus Relief Act's FMLA expansion provision, there's a reason for that. The two are in fact identical. Now, what I expect to see here, and what I think the DOL clarified this morning, how they envision this working, how the DOL envisions this working for someone who has to stay home to care for children due to a COVID-19 related closure of a school. They would see the employee taking 12 weeks of FMLA. For the first 2 weeks of that FMLA leave, the emergency paid sick leave will run concurrently with the FMLA. So for weeks 1 and 2 of FMLA, the person is going to get paid under the Emergency Paid Sick Leave Act. And then for weeks 3 through 12 of the FMLA, assuming it's needed, the person would be paid under the paid leave provision that was built into the Emergency FMLA Act. The employee, the third reason here, the last reason, the employee is experiencing any other substantially similar conditions specified by federal authorities. What I believe that is aiming at, you'll note that all of the provisions we've gone over, both for the Emergency Paid Sick Leave Act and for the Emergency FMLA Act, all specifically include the phrase COVID-19. I think what the government was concerned about here is if at some point this year the COVID-19 virus mutates into a different virus that's renamed COVID-20, let's say, I think the government wanted to make sure, the legislature wanted to make sure that public health authorities would have the ability to issue a reclassification and clarify that this law would apply without Congress having to go through the difficulty of passing another piece of legislation related to that. So the three categories of leave that are shown on this slide are paid at the greater of 2/3 of the regular rate or minimum wage, not to exceed $200 per day or $2,000 in the aggregate. So again, if you go back to the FMLA provision that we talked about, the expanded FMLA provision under the Coronavirus Act, these three types of leave are compensated at the exact same amount as the FMLA. So in other words, someone who is taking FMLA leave for their child care due to COVID-19 related school closure, that person would be able to use 2 weeks of the emergency paid sick leave, followed by 10 weeks of the paid emergency FMLA leave. All 12 of those weeks would be compensated in the exact same way. 2/3 of the employee's regular rate, not to exceed $200 per day, well, for this $2,000 in the aggregate, for the FMLA, $10,000 in the aggregate. Now for some good news, there is a payroll tax credit for this. On March 20th, the IRS announced that tax credits were available on a dollar-for-dollar basis for payments under the emergency paid sick leave, payments under the emergency FMLA leave, and for employer costs incurred to maintain health insurance while on leave. And Mary, do you want to talk about this? Are you on?
Yes, John, can you hear me?
Yes, I can.
Okay, thank you, everyone. Good morning. My name is Mary Dempsey. As John indicated earlier, I'd like to thank you all for joining us. I noted while I was sitting here listening to John, we have over 300 participants, and I think it's quite indicative of the unique legal challenges that COVID-19 is giving to our employers. Like John said, I do have a little bit of good news, and I'm going to get into a little bit more detail on the payroll tax credit and how that will affect your business. So it was just 5 days ago that the IRS announced the tax credit, and I do believe late last night additional guidance came down, which I had a quick chance to look at. But as John said, these are for the employer's payments for emergency paid sick leave, FMLA leave, and you are allowed to include your health insurance premiums that you are paying for to maintain the employees' health insurance during that time. Now, what we were waiting on is some issues regarding timing, and it did come down yesterday, and what we're expecting is this is going to be effective April 1st, which, as everybody knows, is also April Fool's Day. And the government has said, they've made it clear that at least for 30 days, they're not going to have any enforcement actions against employers for any violations, because let's face it, it's going to take people time to get in touch with their CPAs. It's going to take people time to get caught up on that. So as long as you're operating within good faith, you're going to be okay on that. And that's not really one of my main concerns. Now, we've been clamoring for some guidance on the timing of the reimbursement, because as we all know, this is turning into quite a costly endeavor. And the employees have been utilizing the leave. One thing that came through loud and clear yesterday in the guidance that was sent out is any type of paid leave that has been provided to your employees up until April 1st will not count towards the tax credit. So that's something that we didn't know how the IRS was going to come down on that, to be quite frank with you. Now, as written, the law was initially really feasibly not very helpful or logistically feasible regarding the tax credits, because it said that the employer would be reimbursed at some later date. Well, we've all dealt with the IRS, and historically that can be weeks, months, or even a year. Now, in the guidance we got last Friday, the IRS made it clear that the employer would be able to recoup these payments ASAP and or immediately. And the way they've set it up actually seems quite workable, that the employer is going to be able to keep a portion of the deposit that you would otherwise pay as part of your employee's federal, Social Security, or Medicare taxes. So let's just go through that very briefly. As you know, when you pay the employees, you're required to withhold from the employees' paychecks the federal income taxes and their share of Social Security and Medicare. You're then to deposit the federal taxes along with the fair share of the Social Security and Medicare with the IRS and file your quarterlies. So under the guidance, and again, we're expecting more, it might be the one last night, we all need to take a closer look at that. Eligible employers who are paying for the qualifying sick leave or child care leave will retain that amount of the payroll taxes equal to the amount of the qualifying sick and child care leave that you paid, rather than deposit it with the IRS. So that's helpful. That's an immediate cash payment in your pocket. The payroll taxes include, again, we said the retention of the withheld federal income taxes. So I like the way that they have set this up. It seems like a very workable program. And again, it seems to put some immediate cash in an employer's pocket to cover some of these upfront costs that we're seeing with regard to both of the acts that John, or all the acts, I should say, that John last covered. Now, John, if you would go to the next slide, please. Let's go over this example from the IRS, and it's actually very simple, which I'm quite happy with, because normally IRS regulations can be extremely complicated. If an employer pays $5,000 in sick leave for eligible employees, and you're required to deposit $8,000 in your payroll taxes, you can use up to $5,000 of that $8,000 to make the qualified leave payments, depositing the remaining $3,000 on your next regular deposit date. Okay, so that is a simple formula. If you pay $10,000 in sick leave and you're required to deposit the $8,000 in taxes, you can use that entire $8,000 to make the qualified leave payments. And then you file a request with the IRS for what we're calling an accelerated credit for the remaining $2,000. We're not 100% sure how that's going to work yet. We're being advised that it's going to be some sort of a form. I have been somewhat impressed by the way the IRS has operated functionally. We have not seen this occur yet, but at least in the regulations or the guidance that they have given to us, they do seem to understand the effect this is having on employers, and they do seem to understand the immediacy that is needed for these accelerated credits in the event they are needed. So I think that's good news as well. Now, again, I said before, any sick leave or any of the acts that John has already talked about, if you paid your employers up until April 1st, I hate to use it, but that's probably going to be looked at as gratuitous to the extent you're not going to be able to use it towards these credits that I am now discussing with you. Before I quickly cut over to discuss a workers' comp issue with you, I would like to discuss, and again, we're awaiting further guidance, but there is a small business exception because I'm not sure of who we're speaking to on the webinar. Small businesses with fewer than 50 employees will be eligible for an exemption from the leave requirements relating to school closings or child care unavailability, where the requirements would jeopardize your ability to keep your business open or to allow it to continue. The exemption will be available on the basis of simple and clear criteria, and it's going to be made available in circumstances involving jeopardy to the viability of an employer's business as a going concern. And again, we're waiting for additional rulemaking to help us clearly articulate this standard, but there does seem to be some sort of an acceptance or an understanding on behalf of the government that this could have some sort of fatal effect on some small businesses. So please keep that in mind. If you are a small business, we do have that exception that potentially could be available to you. And again, there'll be further guidance on that in the future, and we'll be able to speak more on that. John, if you'd be kind enough to go to the workers' comp slide, please.
Yes.
Now, most of us deal with workers' comp on a daily basis, whether it be a back injury, a neck injury, you know, someone slips and falls and breaks their foot. This is going to be a totally different situation. What we have seen thus far is if an employee can show that he or she contracted COVID-19 through work-related exposure. So again, we're not talking about an acute or a traumatic injury. This is exposure. The employee may have a claim that the COVID-19 is an occupational illness or injury. We kind of call it an OD claim under the workers' comp world. John has noted that occupational exposure could be work-related travel or documented exposure in a healthcare facility. I will say my take on this is going to be very it's going to depend on what type of industry that the claim is coming from. I did a lot of workers' comp earlier in my career, and if I'm sitting in my law office saying that I contacted it from someone at work, this is all going to come down to causation. If you look at the third bullet point, causation remains a key issue. I would say causation, with all due respect, is probably the only issue, because if you have the disease, you've already proven that you've had it. But if Mary Dempsey's coming into her law office or working at home and she's with her kids and she's at Garrity's Market, it's going to be very difficult to prove causation for me. Now, conversely, if Mary Dempsey is an RN working each and every day in a healthcare environment and I can prove extended exposure, over an extended course of time, and I'm going home to a home where I live alone and there's no one else in the home, that is going to be a case that, to me, an ALJ or a workers' compensation judge is going to be much more liberally interpreted, okay? So as COVID-19 has now spread widely through the bulk of the country, again, it is becoming harder to show that the employees contracted the disease through occupational exposure. So it's kind of fluid. It's a work in progress. Right now in Pennsylvania, it is not listed as part of the Pennsylvania Occupational Diseases Act. I don't know if that will change. I have been told that across the state, some police and firemen are trying to get that put together, some sort of legislation. I've also been told that as of right now, they do not have a sponsor for that legislation. So my best advice on that is a couple things. If you get an initial workers' comp claim on this, and again, if you're in a healthcare industry, you may want to look at it differently because, again, some of these people are on the front lines fighting this disease. And if push comes to shove, I do believe a workers' comp judge could liberally interpret it for that group of people or people in any type of medical industry. That being said, if you're working in a factory environment, a manufacturing industry, or even a professional office, I do think the best course is to deny it at first. There's too many issues regarding where this COVID-19 could have come from. Like I said, your family, the supermarket, etc. The second thing, if you tend to have a sympathetic ear towards that specific employee, or you tend to think that perhaps he or she maybe did contact it at work, issue what's called a temporary notice of compensation payable. That gives you 90 days to investigate it further. They do get paid during the 90 days, but at the end of 90 days, if you find any evidence to show otherwise, you can then deny the claim. Now, real quickly, before I turn this back over to John to finalize, the tentative burden of proof on most workers' compensation claims is that the injury had occurred, and a doctor, a medical doctor or any other type of doctor, has to opine within a reasonable degree of medical certainty that the injury occurred in the course and scope of employment. With an occupational disease claim, the doctor has to opine that it is more likely than not that the exposure was at work. So it is definitively a lower burden of proof if this were in fact able to come through as an occupational disease. And again, I go back to John's point, you know, where are the doctors going to come down on this? They're overworked already. Are we going to be able to get them to provide the medical slips? Are we going to be able to get them to provide the depositions that we need in order to support the employees who are trying to make these claims? So again, with those factors in mind, I am taking a quite cautious approach to workers' compensation matters. I hope it doesn't sound too strict or too difficult or too hardcore, but until these things work through the system a little bit more, I just think from an employer standpoint, it is not wise to put people on workers' comp for this particular disease. If there's any questions on these particular issues, John and or I will be happy to answer them at the end of the presentation. John?
Thank you. We're going to move on here and talk about unemployment compensation basics. And I know that we're running a little over what we were initially allotted on our time, but we're not going to be too much longer here before we hit the question and answer portion of the presentation. Basically, the UC law, as most of us know, recognize two types of claims. Termination claims, which is really any claim where the employer ended the relationship. In those, the claimant is presumed to be eligible and the employer bears the burden of proof. And a voluntary quit claim, which is a term used for any separation that was caused where the claimant ended the employment relationship. In those, the claimant is presumed ineligible and the claimant bears the burden of proof. Under both of those prongs, the claimant also has to be able and available for work. So, you know, in terms of UC and COVID-19, if your workplace closes or you're furloughing or laying off employees, there is little doubt that they're going to be eligible for unemployment comp benefits. Employees should also be eligible if a doctor orders the employee to self-quarantine, the public health authority orders an employee to self-quarantine or isolate, or an employer reduces hours due to COVID-19. Now, a reduction in hours would likely result in a partial rather than full benefits. But nevertheless, in a reduction in hours situation, an employee should be able to apply to unemployment and at least get some level of benefits. How we're advising employers to respond on these cases, and again, we're trying to keep this relentlessly practical and not get into a detailed description of unemployment comp here. To help employees who lose employment due to COVID, we'd recommend filling out the reason for the separation on the UC paperwork as follows. So when you get, if in Pennsylvania, when you get your employer questionnaire, for the reason for separation, you want to state the employee was, either laid off, had hours reduced due to the coronavirus, either a shutdown, loss of business. The employer is not contesting this application for unemployment. And I think that should get it past the powers that be in the service center, which is what we'd be looking for to get the employee blessed for benefits. Now, I will say this, throughout this time, we're going to continue to have employees who are, those companies that are operating, are going to continue to have employees who commit willful misconduct, who resign for reasons that shouldn't entitle them to unemployment. In those cases, you should continue to fill out the employer questionnaires, or if you're outside of Pennsylvania, fill out the paperwork in whatever way you would, and continue to contest those claims in the normal course of business. Finally, one portion of the Families First Coronavirus Relief Act did provide some additional emergency UC benefits. It gave federal funding to state UC funds and opened up the federal emergency benefits, which is an additional period of 26 weeks after state benefits expire for any state that hits a few requirements related to COVID, including waiving the requirement that someone look for work to get benefits if they're separated due to COVID, and waiving the waiting week. So in other words, employees would start to be eligible for benefits effective the first week they file. Pennsylvania has taken both of these steps. So in other words, right now in PA, there is no waiting week for separation due to COVID, no work search requirements if you're separated due to COVID. So with that, that brings us to the question and answer portion of our presentation. If you have questions, please submit them using the chat function. And if you have any, and we'll do our best to go through them and answer those questions. We have a question I see from one participant asking if we'll forward this presentation to participants. The Chamber does have a copy of the presentation, and the Chamber will, as I understand it, distribute that to any individual who's attending who contacts the Chamber and asks for a copy. So let me go through a few of the other questions we have. One question, can an exempt salaried employee collect unemployment? The short answer is yes. If an exempt salaried employee is laid off, that employee can collect unemployment in the same manner as anyone else. If you have an exempt salaried employee who has a reduction in pay that doesn't result in a reduction in hours, I think it's unlikely, I would think, in that circumstance that that employee would qualify for unemployment, because I'm not sure that the reduction in pay would be sufficient to qualify them for a partial. You can try. There's certainly nothing wrong with the employee filing an application for benefits, but I would think in most cases they're not going to be approved for benefits by the service center. So we have one other question here, and the question is, if employees are sent home to keep them safe, will that qualify them for leave benefits? That's an interesting question. It's a good question, because we are seeing a lot of employers who are facing issues where employees aren't reporting to work due to fear. And Mary, jump in here if you have anything to add. But my read on this in terms of the paid sick leave portions here is that an employee has to hit specifically one of the eligibility criteria in the statute. So if an employee is staying home because their doctor has instructed them to self-quarantine, I think they would be eligible for benefits. If the employee is staying home because they are quarantined by a public health authority due to COVID exposure, I think they would be eligible for benefits. If the employee is simply staying home themselves without one of those orders, I don't believe that would qualify them for benefits based on the guidance I've seen. Mary, do you have anything to add to that?
Nothing to say, except that I agree with your answer 100%.
Okay. So we have another question here, and I think these are really related to, this is really a workers' comp question, Mary. What are our thoughts on employer liability for fatalities with some provable cause that COVID might be caught at work?
Yes, I've kind of already thought that through the things I do at night. I think it's a real issue, to be candid with you. And for those of us who have practiced in the workers' comp world, there is always a tendency on a fatal claim for it to be more liberally interpreted, because there is a tendency to want to give benefits to the family. And the other situation that we have at hand here is there is no doubt that this can be a fatal disease. Now, does it take away the causation issue? It does not. They still have to prove causation on a fatal claim. So again, you know, if it's a nurse and someone who's working on the front lines, his or her burden of proof on that is going to be a lot easier than Mary, who's working in a professional office. And again, who are you going home to at night? You know, have you been at the grocery store in the past 2 weeks? So you still have to take into all the factors regarding causation. But my gut instinct is they're going to be somewhat liberally interpreted, and I go back to my initial guidance, depending on the industry.
Thank you. So we have a question here, an additional question. Can you comment on the difference between layoff and furlough relative to the stimulus bill that was passed last night? Generally speaking, you know, there really isn't a difference between a furlough and a layoff. I mean, a furlough is a layoff. In both cases, employees are separated from employment, and regular procedures that would govern separation from employment would apply, or would normally apply. Furlough is used because it is a kind of a term of art in the HR community. It's less threatening than the word layoff, and it generally implies that an employee we expect that we're going to recall you to work after some period of time. In other words, a furlough is really a synonym for a temporary layoff. So, you know, in terms of these relative to federal legislation, you know, if you're really the key is whether you're permanently or temporarily separated from employment. But I haven't looked at the stimulus bill last night very closely at this point. But what I would say is really you would just focus in on really the difference as to whether the separation is permanent or temporary, or whether it matters. If there's a benefit in that stimulus bill that is generally applicable to people who are laid off, who are separated from employment, I would expect and again, it's always dangerous to speculate like this. We would want to wait and see what the final version of the bill says. But my gut reaction is that an employee would be eligible for those benefits, any benefit that would be available to someone who was laid off, regardless of whether the company used the term layoff or furlough. Mary, I don't know if you have any thoughts on that.
No, I think you've covered that, John. I agree.
Okay. So we can take a couple of more questions here. We have one question here, and this is a very good one. How do we determine if a person is eligible for family leave if they are using it for childcare? Do they need to contact the employer? At this point, I have not seen any certification form from the Department of Labor relative to family medical leave or emergency paid sick leave for childcare. Mary, I don't know if you have seen anything like that.
I have not, but I think it is fair to be able to request some sort of documentation at this point, absent even having a formal form.
Yeah, I mean, I think you can try and you can follow up with the employee on that. I'm not sure what documentation, I'm not immediately certain what documentation we would get. You know, I guess one practical question is, do you know if your employee has children? You know, if the employee is not on your health insurance, there's a possibility that you might not I mean, generally speaking, we know from the governor's order that all school and child care facilities are currently closed. So if an employee, if an employee has children, we know from public record that the school and child care facilities are closed. I suppose the question would be whether there are other child care arrangements that the employee might be able to make. I guess the best answer that we can give to this question right now is we're not aware of any certification form from the government. I think you would be free to, I would expect you would be free to ask the employee certainly, what the reason for their leave is to confirm whether they are in fact using it for child care. But we're all going to have to keep a lookout for additional information from DOL on this particular topic. It's a very good question, and I wish I had a better answer for you. If we become aware of any guidance from DOL on that particular point, we will put out a client alert on it. So let's take one more question here. All right. Must an employer allow a furloughed employee to take PTO before applying for unemployment compensation? The key thing here from my view is that you can't allow an employee to double dip. An employee can't be receiving pay from the employer and unemployment compensation in the same week. Now, my understanding of how the unemployment benefit system works is that every 2 weeks, I believe it is, an employee has to log into the service center or call the service center to update their claim, keep their claim opened, and inform the service center if they've had any income during that week. I'm not aware of anything that would require an employee to take PTO before applying. But if they don't use their PTO before applying and they subsequently get paid out for it, they're going to need to report that income to the service center so that the service center can take that into account when they're issuing benefits for that week. Mary, do you have any thoughts on that? Or?
No, I think you've covered it.
Okay. Well, in that note, I know there are a lot of questions here that we haven't had time to answer. You'll see that our email addresses are on this slide. If you would like to email us those questions, we'll do our best to get back to you. Thank you all for joining us today, and we will do our best to keep everyone up to date on this, and stay healthy, and let's all hope that this is over as quickly and as quietly as possible. Thank you.
Thank you.